Good afternoon, and welcome to Aspen Ideas Health. On behalf of the entire Abbott organization, I am humbled and honored to open this next panel honoring the legacy of Dr. Paul Farmer. Dr. Farmer lived an extraordinary life of service to mankind. From the personal care he provided his patients, to the many people he inspired, mentored, and advocated for, from Boston to Haiti to Rwanda, Malawi, and beyond. In this session, you will hear amazing stories of his immense impact on the well-being of people around the globe. But first, I want to share one aspect of his genius that may be underappreciated: his leadership on the economics of health. Our work with Partners in Health to build a nutrition facility in rural Haiti was just one example. He was a champion for how this facility could enable free medical nutrition to patients who needed it. He also recognized the need for sustainable systems and strongly supported the idea that the facility produce and sell Haitian peanut butter. This vision continues to this day, providing the facility financial sustainability and local economic development for the community. The loss of Paul's visionary leadership for social justice and health equity, and his compassion and friendship built over decades, was and still is devastating. Yet, we can take comfort in knowing many people are working to keep his legacy alive, including the panel that joins us on stage today. And with that, I'd like to turn it over to the moderator for this session, Lola Adedokun. Thank you.
Thank you for that welcome. And I can't say more how privileged I feel to be able to speak on behalf of such an enormous leader, how honored I am to be able to do that in a space like this with so many people who knew him, who knew his legacy, and worked side by side with him to change and save lives. I am Lola Adedokun. I'm the executive director of the Aspen Global Innovators Group and co-chair of the Aspen Forum on Women and Girls. The Aspen Global Innovators Group was launched over 30 years ago to widen access to health and prosperity for people living at the world's margins. But as we look forward, we are committed to expanding our vibrant and visionary ecosystem of collaborative global health leaders who are advancing equitable health and prosperity locally and globally. I say this because the vision for this program was inspired by Dr. Paul Farmer. As an activist, visionary, mentor, father, entrepreneur, physician, and disruptor fundamentally, Dr. Farmer dismantled barriers to care and empowered communities to take the lead in delivery of their own care. Paul devoted himself to working on the seemingly intractable issues confronting under-resourced settings and communities around the globe, like access to water, hunger, non-existent medical services, and inequality. Most importantly, he bridged the critical link between social justice and health and reminded us all that health is a fundamental human right. Paul taught us those around him the power of accompaniment, humanity, and solidarity, key principles that the COVID-19 pandemic made ever more clear to us over the last 2 years. And I can't hammer home more this point about humanity. We have been reminded that we cannot do any of this work. We cannot see a future decade without remembering how closely we are to one another, how interdependent we are across borders, across cultures, and across societies. He inspired and left an indelible imprint on millions of individuals around the world. and I'm honored to count myself among those whose professional and personal life was influenced heavily by Dr. Farmer's vision, his bravery, and his activism. I decided to pursue public health primarily because I saw what he did around the world, and I saw that it's possible as one person to serve millions around the globe, so it's a privilege. Paul Farmer and his social justice and health organization, Partners in Health, have been long-standing partners with the Aspen Global Innovators Group in delivering on our shared vision of empowering community leaders to deliver high-quality care to those in the most overlooked settings, both in the US and around the globe. And again, a reminder that we are a global community, and the US is very much a part of that global community, and we have so much to learn from that global community. After Dr. Farmer's untimely and shocking passing this past February, leaders around the world shared personal, moving tributes about the impact that Dr. Farmer has had on their lives and their communities. He left a legacy and a vision that we've all committed to carry forward. And today, we are privileged to take the opportunity to celebrate Paul Farmer's life and legacy by continuing to work to address the systemic disparities and persistent inequalities that limit access to quality care and limit so many people from living their fullest lives. We're pleased at the end of this session, after we reflect on Paul's legacy, on our colleagues here, to share an announcement about a partnership between Partners in Health and the Aspen Global Innovators Group to continue to carry on that legacy. With that said, I'm pleased to introduce very briefly our esteemed panel, starting with Dale and Niyizonkiza, who's the founder of CEO of Village HealthWorks and is a leading health advocate for some of the world's most impoverished and vulnerable people. He was born in rural Burundi, escaped to New York City when his medical studies were interrupted by the catastrophic war that lasted more than a decade and took the lives of hundreds of thousands. I'm also pleased to announce, to share the stage with Marc Julmisse, who's the Chief Nursing Officer and Deputy Chief Operating Officer at a 3,000-bed hospital in Haiti, Zanmi, Lasante. She serves as the Deputy CEO and shares the responsibility for the clinical, financial, and operational leadership of the system. I'm also pleased to share that, as I noted at the top, I'm the co-chair of the Aspen Forum on Women and Girls, and Marc was a fellow in that program in the first cohort, so she brings an incredible, important lens around gender equity and justice. And finally, at the end of our panel is Dr. Anatole Manzi, who serves as the Deputy Chief Medical Officer at Partners in Health, and has been a long-standing colleague of mine for over 20 years, and also participated in one of the Aspen Global Innovators Group's New Voices Fellowship. He's a 2021 Senior New Voices Fellow. So it's a pleasure to have you all on stage. And now I'll turn to you leaders to share the indelible impact that Dr. Farmer has had on your legacy and your leadership.
Thank you. Thank you so much, Lola, and thank you so much, everyone, for your time here. It's really hard for me, as it is for all of you here, because I met a number of people who were really family, talking about the legacy of Paul Farmer. We should be talking about Paul Farmer is, not was. And just starting from my own personal friendship with him, I met Paul in Boston 20 years ago. The first day we met, we spent 24 hours together. We talked non-stop. And it was all about global issues, inequities, and problems. And during the first hours, I was really curious because I had never met anyone in this country, and it's today 28 years in the United States, who really could speak in the language of Paul Farmer. And everything he was talking about was the stuff I was born and raised in poor Burundi. And I was shocked by how much he understood about the world. And so over the years, we really became brothers from another mother. Our families together. I am the godfather of his son. And we work together. We travel together. We caused so many good troubles together. And when I received a call at around 4 a.m., I was in my bed in New York, in my home at around 4 a.m. from Rwanda. So I ignored that call. I didn't know what it was, and then a text followed, and I ignored that. I had a long night, and I was just trying to sleep. Then I really didn't go back to sleep. An hour later, I got a call from Catherine, his daughter. Uncle Dale, Dad is dead. Dad is dead. I really left my bed and went into my living room, and I looked up in the sky. God, you are not a good God, if this is true. It really took time for me to believe that he was gone until when I was in Miami and I saw him. So reflecting on that life together and the work he has done, he was a true friend of humanity. We went together to Burundi, to Rwanda. He would sit down with kids who had nothing in common with him but our humanity. And they would laugh, talk, stories and all that. And so his life has inspired so many of us who are here, and the millions of others who never had the chance to, and the honor to shake his hands or hug him. But that is what really keeps me, my hope alive, and it's the consolation. When I was at Partners in Health in 2000, it was that time where HIV was decimating communities, mostly in Africa. And back then, the HIV cocktail was available to rich countries, not available to anyone else in Africa, including in poor communities around here. And he waged a war. He believed, rightly so, that poor people, his patients in Haiti, wherever he was, deserved to have exactly the same kind of treatment that everyone else had access to. And we, I remember Ophelia Dole, Joya Mukuchi, and all of us at Partners in Health driving from Boston in the middle of the night, going to DC, protesting and causing trouble, the good trouble. It was quite something, really moments with him and others I carry in my heart, and it's such an inspiration. So long story short, there were even some colleagues really who somehow believed that it was not possible to give HIV cocktails to those poor countries in poor resource settings. Really outrageous, arguments. Those poor people in Africa cannot tell the Western time. They don't have wristwatches. These medications needed to be refrigerated, and so on and so forth. None of these, of course, was true. So later on, in 2003, PEPFAR came out. And of course, HIV medicines, ARVs, they were available, and people had access to that. And the poll didn't stop there. We went to Rwanda. I was one of the people coming from medical school because I speak the language and all that, into communities with him. I remember a story driving. It was dusty in a dry season, and we looked at each other. Paul said, "My goodness, that thick of dust covering you, it's incredible." And I said, "Well, you don't see yourself. It can be as bad as it is, what I see." And then someone looked at us and said, "You all look alike." All this to say how much fun we had doing this incredibly hard work with friends and doing something beautiful. And that is something that I miss so much.
Yeah.
He's irreplaceable, but he has really inspired all of us. And that gives me so much hope. And my hope is that we all collectively link arms and continue that legacy, do good regardless of where we are. And I think, as Paul used to say, with this issue of socialized scarcity, meaning our imaginations to what is possible has been diminished. And wondering really when we talk about other people who are stuck in extreme despair, what kind of outcomes would we expect if we were thinking about our own families, our own children, our own mothers, and all that? So I think this kind of disconnect that makes us strangers is what we really needed to reduce, to see every human being as a human being. And I think some of you have families and children. I have noticed in my recent years, I have 2 beautiful children. I really never believed that there was a room left for me to see someone as kid in a different way, in a more beautiful way. But everywhere I go, I see my 3-year-old son, Charlie, every kid. And it's really rich. And if you could see everyone stuck in difficult conditions as if that person is our own, regardless of the skin color, regardless of where people are, I think we can heal the world. And we can. The world is not poor. What is poor is our imagination.
Thank you, Dan.
What is poor is how we see the other as something else.
Yes.
And we really need to take these issues of inequities and the social justice very seriously. If we don't, through collaboration, not competition, then who we are serving is the person who is a skeptic or lost.
Okay.
And we are stronger. We are much powerful together, and we really can make things happen. And Paul, where he is, will look at us down and smiling with so much joy.
Thank you so much, Dale. Thank you. Over to you, Marc.
All right. And I am mad at him for making me cry because I said I would not. I will tell you, I feel cheated. This is my dream job. I can tell you, when I went through public health, reluctantly, because I was like, I'm not doing public health. Then I kept on seeing things, and I decided to go in public health and learned more. And when I learned about what Paul Farmer was doing, and then about Partners in Health and so forth, I had my dream job, and I did not know. I sort of projected out, said, that's where I want to work. And years later, that's where I had a chance to work. And it was a joy for me because I got a chance to learn from this great man. And I'm going to explain to you what it means by learning. And I feel cheated because I didn't finish learning yet. And that's the thing. In there, when you were talking about advocacy and skepticism, I will tell you, this is what the legacy of Paul is. He was both a visionary, but also personal. He brought patient suffering. He brought it wasn't about the patient, it was about the person. He brought you to there to understand more, not just staying in this development level. I remember when I first started, in 2013, I actually started with Mirabale Hospital, when we were opening this 300-bed teaching hospital in rural Haiti in the Central Plateau after a couple of years after the earthquake, which a lot of people are like, are you crazy? Like, why are you opening a teaching hospital after an earthquake? That's not what we need. But he saw beyond and said, why can't we? I'm going to jump a little bit more. I remember this is not too long after we opened a hospital. We just recently opened the ICU, which is big for this area. And we are presented with conjoined twins. And he said, we're going to do this surgery in Haiti. And I was like, oh. I'm like, really? And I was like, okay. And we had several meetings, and I considered myself a global health advocate. But I didn't realize that I was a global health skeptic at that point. Because I remember at one point, we sat down, we were outside of the ICU, and I was just like, we don't have this, and we don't have this, and I don't think, and we don't have this, and he stopped. And I wish you could see the look he gave me. It was sort of like he was really trying to get me to understand, and sort of like he looked, for me, was peered into my soul and said, Marc, don't tell me what we don't have, tell me what you need. And I literally stopped, and it was like this man was trying to get me to understand this concept of don't limit. Because we're in Haiti, that doesn't mean we can't. And so I sat there, and it took a second, and I was like, okay, so we need a bear hugger, we need this, and it was like, let's go after. Why is that the limitation? And that was my paradigm shift. From that point, it wasn't about what we didn't have or what we couldn't do. It was this is an obstacle. And if we're talking about bringing transplant surgery to Haiti. Why can't we? That's something we met over the years, and that was one thing he said, we need to bring it because there's too many people dying in Haiti. That should not be the limitation. Let's go beyond. So Paul put the vision out there, but at the same time, being so personal, he made us missionaries. Somebody said that in another way. We became part of this mission because we continue. As things are going, we start looking and say, why not? This should not be. And if we can't, what are we going to do about it? How are we going to change not just the health systems, not just the inequities, not just the structure that we have? How are we going to change funding so we can get what we need to get? And these are the things that it's not just me, and I don't feel that I'm still a student, and I'm learning for so many people that learn from Paul. And one thing that I would say about him that stays in my head is be bold and challenge. Don't let those challenges, don't let those obstacles be what we see. Let the patient be what we see and advocate for them. Another thing that stays with us as a mission and we continue, it's not about the illness or the disease. Going back, it's about the patient. Go to their homes, learn about them, hear from them, let them teach us to do what we need to do, hear what they need, and you know what? Do something about it. Because we could be sad and say this about it, but what are you going to do about it? Even to the point where, and that's where he talked about, and I say I'm bathed in this Kool-Aid. Yeah, I'm like totally bathed. Every time I talk to him, I was like, oh man, I could sign up back again. And I was like, oh, I do work here. So I remember, even post-earthquake, the recent earthquake that we just had, and we had flown down and we went down to the south and flew back, and Paul was very personal with the people, and some of the people that came up, the family members. While the patients were receiving care, some of them that were transferred to the Mirabelle Hospital, one lady lost the telephone, and he was like, can we get her a phone? Because she needs to communicate with people. And we were like, oh, we got them food, they're eating. And you know what he said? Like it was his own, thank you. Thank you. Like it was his own family. Thank you for feeding them and thinking about that because they're not the patient. The patient's in the hospital, but they're part of that whole cycle. So when we think about it, we think about the staff, the stuff, the space, the systems, but we think about that social support, that patient. What do we need to do to get that help for that patient so that they're not worried? That's one less worry taken off of them. And I think I feel in a way that I'm not doing justice because there's so much more, but these are the parts that stay in my head. These are the parts when we look at systems of inequity, systems of injustices. He said, fight it. Use your voice, go ahead and fight it, but don't do it alone. Bring the patients with you, get their voice, because those that are closest to them are the ones that are going to have the solutions, right? So if you're close enough to the patients, they're going to help us inform. We can open the door. We can help get those resources. We can get transplant in Haiti. We can get a BSL-3, a biosafety level 3 lab in Haiti. He was audacious in deciding to do that, and we're going to continue to do that. And I think in a part, a lot of people ask, what next? What after Paul? It's not what after Paul. Paul, I have to go back. We're missionaries in this sense. We're part of this mission. There's not what after Paul. He laid the vision. He spoke about, pragmatic solidarity. He spoke about healthcare is a right. It's a human right. And so we have that before us, and we'll continue. I'll continue as long as they keep me. I don't know. I'll continue fighting as God gives me breath to bring justice and bring help to those and not let those barriers that I had initially as a skeptic be my blinders to providing care to patients. That's the legacy of Paul and me.
Thank you, Marc. So we would be remiss. He's alive to us, as you can see, and alive to everyone in this room, but we want to bring him into this room with us. So we wanted to give a moment to show a brief clip of Paul speaking for Paul and for his vision, and then we'll close with a brief announcement.
First question is very simple, Paul. State your name and your title.
I'm Paul Farmer. What do I say next? MD, Chief Strategist, PIH. I love that title, by the way. Founder, I'm proud of that. First Medical Director. I wasn't qualified for that, but hey, I did my best. So there's some titles.
I was driven after 1983 by this raw experience, and a very good one, is how do we make the work we're doing collectively matter?
We didn't know what we were doing. We didn't know how to build a clinic.
Ça y est, architecte, oui. Hey.
The biggest struggles of my life have always been around the fight for social justice.
What could be better than being an activist? It's something you're doing because you want to do it. It's not a job that you're paid to do. It's something you choose to do. So I think that's a big deal, being an activist.
None of our patients have died. One person died a few days after starting therapy because we started too late. And isn't that the lesson of the last 20 years? We started too late.
If I break my leg, you're gonna fix it.
We really believe that all people have equal value.
And we can all build healthcare systems that are compassionate and merciful. To me, that is about hope, and it's about rejecting despair. This work that we are so lucky to do is not just about diagnosing the problem, but about responding to it. And when you do, with even modest resources, the return on that investment is just incredible.
This effort is motivated by love and should be informed by compassion and expert mercy.
Is it okay to write Bravo in a medical chart? I mean, you gotta love this job.
I can't imagine doing anything else with my life.
avez allé, mes amis.
Merci bien. Merci, mon oncle.
Bien content avec nous. Merci pour l'accueil là.
Merci, Polo.
Ok, chérie. Bye.
So, while we all mourn, we are hopeful. This is the hope, this is the community, and I'm pleased to be able to celebrate and bring the humor that Paul brought to his work, to announce a partnership with my friends, family, and colleagues, partners in health, to continue that legacy, to tap into the 50,000 strong army around the world who are ready to take up arms, to bring that compassion, to bring that spirit of humanness in a moment where we are all traumatized by a global pandemic, and it may feel hopeless, but this is the moment of rebuilding. And he reminds us that we can do that. So I'd like to turn to my colleague, Dr. Anatole Manzi, to talk briefly about the work that he's done with Dr. Farmer, but more importantly, about the road ahead and our shared partnership together. Over to you, Dr. Manzi.
Thank you. I think when my son actually asked me about Paul Farmer, I said, look, there's so much I can share, and I don't know where to get started. And he said, maybe I can lend you a time machine and you can go back and just retrieve all the stories. And I think one of these is actually when I met him 17 years ago, and he came in and said, look, I'm going to help you see patients, but you're going to help me with something. And then I said, yeah, that would be great. I can't say no to you. And he said, okay, let's get started with my long queue in Rwanda, where I grew up. I remember seeing his first prescription. If I forget everything, I would always remember the first prescription that he had. So guess what's on top of this prescription? Food package to the patient. The second line, the second item on his prescription, get an accompanier. This is someone in the community trusted who could provide this emotional support and visit every day, bring medication, because he believed that we are interconnected. It's just having a patient and then throw them away. It's just building a community around that and make sure that we are in this together as a community. When it came to COVID pandemic, my team and I were supporting the contact tracing in Massachusetts, and we helped over 12 states, and we are well established in the US now. And we said, what do we do? Because people are not necessarily ready to respond to the pandemic. We launched a course, and I asked it a question in one of the interviews. I said, Paul, do you think we can strengthen health systems during the pandemic? He said, yes. The pandemic is the perfect timing to build strong health systems. And now, before his passing, I asked the same question, Paul, as we transition from the pandemic, what do you see as a top priority? And he's saying, health systems recovery. If Paul was right here this moment, he would repeat the same. As we transition from the pandemic, the big gap that we have is, how do we help these countries where health facilities close the doors? Women are not having, women's health services are closed, nutrition services are closed. And how do we recover from there? Because that could be the silent killer. Indeed, it's the silent killer in countries like Sierra Leone. In a pre-COVID, 1 of 17 women were dying during childbirth. Now imagine what's happening during and post-COVID, where we had closed, some of these facilities were closed. We have the silent killer there. And what we have to focus on is accelerating the health system's recovery, health system resilience. and in giving a new definition, reimagining health systems recovery and resilience. Because traditionally, we say it's getting back to normal. But the normal that we need is really not the actual traditional resilience, which is we don't want to go back to a system where 1 of 17 women die. We want a dynamic system, a dynamic resilience. And with that, with an army of leaders, community members, where Paul said authentic partnership and collaboration is key for us to recover. Yeah. He said this multiple times. There's another thing that he said. He said that humility is the weapon that's going to help us. Although he was a celebrity, he said humility is the only way to keep that connection with the poor and the oppressed. And the third thing that he said is having a fearless voice for the voiceless, those patients, those families, those communities. Through that process, he trained an army of leaders. What do they do? What they have done during the pandemic is helping countries, accompanying communities throughout the response to COVID. After the pandemic, the same leaders, we are partnering. We have a partnership. We are launching a partnership to have these leaders help countries, communities to recover health systems resilience. Having a global collaborative for health systems, dynamic health systems resilience. That is what we need to stop the silent killer, which is now here. And we can get back and say, we are in this together throughout the pandemic, and we can work together to recover from this. Thank you.
Thank you. So with that, as we have been teasing, we're pleased to announce the partnership between the Aspen Global Innovators Group and Partners in Health to launch the community's first global collaborative. This is a 50,000-strong network of ministries of health leaders, patients, policymakers, community health leaders, researchers, pharma, all the parties that need to be involved in a broad, action-oriented, solution-oriented health systems recovery and response. We will share more materials about that following this meeting, but I want to invite you all to join us in this partnership, as has come up through many conversations over the course of the last day and a half already. We know that we need to do this together. We know we need a platform, however, where we can seek the capacity building resources, the knowledge, lessons learned from both this pandemic and going forward. So we want to serve as that platform, that network, that community, where when leaders have questions, and I mean leaders from community all the way to the top at the national and global level, they have a space to really question what is working, what is not working, what mistakes will we never make again, and what solutions will we truly scale? What does scale mean? All the meaty questions. What are the barriers to truly financing health systems in a way that leaders can lead and countries can lead on their own? So we're not wholly reliant on a global body, and we have to wait. So thank you again for joining us. Please look for the formal announcement. But again, our arms are out to you, our hands are out to you to join us as partners in arms in this army for a solution around health system strengthening, community strengthening, building a resilient and strong army of community leaders. Thank you so much for joining us.